Maddie.
I'm Bray.
I'm Augie.
I'm Kenzie.
This is the knee evaluation.
And for the sake of time, we would usually do it bilaterally, but for the sake of time, we will be doing it unilaterally. And we all consent to being touched.
So we will be starting off with muscle palpations and muscle testing. I'll be testing the quadriceps. So the quadriceps consists of 4 muscles, which is the vastus medialis, the vastus lateralis, the vastus intermedius, and the rectus femoris. So the rectus femoris originates from the AIIS, which is up here. Can I touch you? Yeah. Up here. And then the vastus medialis originates from the lateral linea aspera on the lateral side. And the vastus lateralis originates from the greater trochanter, which is over here. And then the vastus intermedius originates from the anterior surface of the femoral shaft. It then inserts on the tibial tuberosity through the patellar ligament. So it comes down through here. It is innervated by the femoral nerve, which is L2 through L4, and its action is thigh flexion and leg extension. So I'm going to have Maddie come to the end of the table. Right. I'm going to take my hand and place it above the joint. Can you come back just a little bit? Thanks. And then I want you to can you please take your foot and bring it all the way up. Beautiful. Thank you. I want you to do the same action, but I'm going to resist you. Ready, go. And as you notice, I put her in an active length tension position, and then she resisted through that motion. And then I'm going to give you halfway. Ready, and then I want you to try and break this and hold it here for 5 seconds. Ready, go. 1, 2, 3, 4, 5.
Okay, we're gonna do fracture testing on the patella. First, we're gonna feel where the patella is, which is right there. We're gonna do percussions, and now we're gonna do a tuning fork.
Next, we'll be doing ligamentous testing. I'll be testing Maddie's MCL. So the MCL is on the medial side of the knee. This is also known as the valgus stress test. So I'm going to take my left hand and put it here, and then my right hand goes on the ankle. And I'm trying to redo the action of the injury. So I'm going to pull that. And I'm pushing with this hand and pulling with this hand. I'm going like this. We will be now testing the LCL, which is on the lateral side of the knee. For this, we'll be doing the varus stress test. And for that, we're doing the same thing as the valgus, but we're going to switch our hands. So now we're pushing with this hand and pulling with this hand. So I'm going to take my hand placement goes here. And as you can see that there was an endpoint on both tests, so she does have an intact MCL and LCL.
Walkman's test, which tests for a torn ACL or sprained ACL. To do this test, we're gonna start with putting the leg in a 20-degree flexion, and then I will put my left hand on the femur and my right hand on the tibia, and then I will put downwards pressure on the femur.
Now we're going to be doing the pivot shift test. This is looking for ACL injury. For this, we're going to secure the foot, and then we're going to first, it's a multi-step process, so we're going to internally rotate, we're going to apply a valgus compression, we're going to compress, and then drive through. any clunking or discomfort would be a positive for an ACL. Next, we're going to do the Houston's test. This is testing for medial plica irritation. So we're going to have the patient lying supine, and we're going to put her knee, we want her to relax so there's no muscle guarding. And I'm just going to, as I'm internally rotating the leg, I'm going to be shifting it medially and going into extension. And I'm looking for any clicking or popping or shifting. I do kind of feel a little bit of popping in here, but
So now we'll be ligament testing the ACL and PCL using the drawer test. We'll be doing the anterior drawer first, which is testing anterior translation of the tibia, which is the main action for tearing the ACL. So this is testing the ACL. So what I'm going to have to do is have the patient come over. I'm actually going to sit on her foot, and then I'm going to take my hands and I'm going to be on her tibia, and I'm going to go back and then jump forward. Go back, jump forward. And there's an end point, so she has an intact ACL. Now the PCL is just the opposite. So I'm going to come up and then go back. Come up and go back. And she has end point for both.
okay, so next we're going to be doing the reverse Lockmans, which is looking for PCL injuries. You just do the same thing as Lockmans, but instead of pulling the tibia up, you're pushing the tibia down and pulling the quad up. Looking for an endpoint.
So now I'm going to do the sag test. So I'm going to have the patient lay supine on the table, and I'm going to hold her legs up. And this is testing for a PCL tear. So I'm going to hold her legs up. In this test, if the gravity pulls the tibia down and there's a sag in her leg, there'll be a noticeable difference, and that would be a positive sign of PCL tear if there's like an indent. So now I'm going to do a Godfrey's test, and for these tests, it's always good to have someone next to you or like looking from the side view to see if they see anything as well. So for the Godfrey's test, this is also testing for the PCL tear. So I'm going to take her legs, and instead of holding them straight out, I'm going to put them at 90. And I'm going to look for the same thing. If there's an indent right at the tibia, or if the tibia makes an indent in the leg because of the gravitational force. So now we're going to do the Loomer's test, and this test for the posterior lateral horn of the meniscus. And if the positive test of this would be pain. So you're going to put the patient's legs up at 90 again. Okay. Okay, and then we're going to externally rotate them. And pain would be a positive sign of this. So now I'm going to do the tibiofibular translation. So I'm going to find the head of the fibula, right around here. I'm going to translate it. So it's going to move into the tibia. I'm going to do range of motion of knee flexion. So I'm going to line up the axis with the joint line, right here. And then the movable lever arm is going to be lined up with the fibula, and the stable lever arm is going to be lined up with the femur. Okay, so we're actively going to test this. So he's going to first move his leg up on his own and see what his range of motion is. So you got 110 actively, and now I'm going to passively push it down and see how much further he can go. So he went from 110 to about 120, from actively to passively. So I'm going to do the McMurray's test to look for a meniscus tear. So I'm going to put my hand over the joint line. I'm going to take her leg, put my hand underneath like this. I'm just going to mix around, just move it around and turn it. And I'm looking for clicking in her knee to be a positive test.
Alright, so the next one we're going to do the Taylor's test, which is testing the sartorius. For this, we're just going to have the patient go and do the range of motion by herself. I'm going to ask her, can you put your right heel to your left knee? Perfect. And I'm going to have her do the same range of motion, but I'm going to resist it. I'm going to resist the hip flexion and the external rotation. So can you do it again? I'm going to let her do the motion, but I'm going to make her work for it. Okay, perfect. And then we're going to do the break test. So we're going to find the midpoint. And I want you to keep this in this position. I'm going to try and break it, but don't let me for 5 seconds. Ready? 1, 2,
3, 4, 5.
So now we're gonna do the grind test. So I'm gonna press the patella down with my middle finger and thumb, and then I'm gonna move it with my pointer finger. This is testing for PFC.
We're doing a sweep test, which tests for intracapsular swelling of the knee. I'm gonna do this by sweeping up on the medial side of the knee, and a positive sign for this test would be excess fluid going into the posterior lateral side of the knee. We're going to be doing a balancable patellar test, which tests for intracapsular and extracapsular swelling. We're going to do this test by pushing down on the patella, and when you do this, the fluid should go to the sides of the patella, and when you let go of it, it'll rebound with the patella.
We will now be doing the Ober's test, which tests for IT band tightness. So for this, I'm going to have my patient lay on the side, then I'm going to have her flex the knee and adduct the hip. And then now I want her to try and see if her knee can touch the table. So hers can, so she does not have IT band tightness. If she were to, her IT band would only allow her to get to like here. We'll now be doing the Noble's test, and this is testing for flipping of the IT band over the lateral epicondyle of the femur. So I'm going to take my hand, I'm going to find her lateral epicondyle. I'm going to ask her to extend her knee, so can you take your foot and bring it up? All right, can you just do that repetitively? Thank you. And a positive would be that flipping, or feeling that flipping sensation on that lateral epicondyle.
Next, we're gonna measure our PICU angle. So for this, I'm gonna have the stable lumbar arm. I'm gonna have it in line with our ASI strength. So you just point to it for me, right? I'm gonna have that in line there, and then I'm gonna have the axis on the patella, and then I'm gonna find the tibial tuberosity, and I'm gonna go in line with that. She is about 12 degrees, and that is normal for, or it's a little low for a girl. Normal for a girl is 15 degrees to 20 degrees. So next we're gonna do the Wilson's test. For the Wilson's test, we're gonna ask our patient to internally rotate, so can you perfect, and then can you extend your knee? That would hurt. And then you go down, and can you revert? Yep. And then do the same, externally rotate. Any pain? Alright.
We will now be testing the circumference of the leg. This is helpful for any kind of swelling to do this, and we would do it on both sides of the leg and compare, but for time's sake, we will be doing it on just one. So I put out dots for 2, 4, 6, 8, 10 inches from the joint line. So I'm going to measure in inches, and I'm just going to come around. Zeros there. She's about 13.5 inches. We're going to come up. About 14 3/4. Come up. 16. About 17.5. 19.5. And then about 21. And again, we would do it on both legs.
So we're gonna do measuring leg length, and we would do this bilaterally to compare, but for the sake of time, we're just gonna do it unilaterally. So we're gonna line up the tape measure on the lateral malleolus, right here, and find the joint line right here. And it's about at 14.5. And then you're gonna go from the joint line to the greater trochan, about right here. And it's about 16. So you would add those together and get the total leg length.
Hi, I'm here with a 20-year-old patient named Maddie. She's a soccer player. So what happened?
I was in a soccer game and I went to stop and go the other way and my leg just gave out.
Oh no, I'm really sorry to hear that. Have you ever hurt, which knee is it?
My leg.
Have you ever hurt this knee before? Do you have any kind of allergies or past medical history I should know about? No? What type of pain do you have? Is it like chronic? Do you feel all the time? Is it worse when you run? What is it?
I just feel instability all the time, like walking. I don't go out try and run because I feel like my leg's just gonna give out.
Okay. So sorry to hear that. What kind of surface were you playing on?
Turf.
Turf? Okay. And did you hear a pop or a crack?
I kind of heard a pop.
A pop, okay. Alright. So I did anterior drawer test and I did a Lockman's test, and they're both positive and she had no endpoint. There's also some intercapsular swelling, and so I would send her to get an MRI as I would think it's an ACL tear.